Okay, welcome everyone. Thank you for joining us. We are here with Luke. My name's Anya, and we're here to talk about emergency preparedness Q&A. I'll start just really briefly. My name's Anya. I run a Bowery Analytics IT company, and I got introduced to Luke through the Mothers in Technology group that's on Facebook. And Luke was kind enough to join us to answer some of the questions that we have around the COVID-19 virus and all the issues that we're seeing and hearing about on the news. So we wanted to talk about why are we doing this, right? Why did we choose to put this together? We have some questions and answers, mostly because we're seeing lots of information from many different sources, changing constantly, and not really feeling confident that we have a really good place to get the right information. So we wanted to put all that together, and we felt that Luke could help us out. And let me introduce you to, say hi to everyone, Luke.
Hey, thanks for having me.
Excellent. And let me introduce you to what his background is so that we understand why he's talking about this and that he has the experience. So Luke is an EMT and an Eagle Scout, which again, I think those are wonderful things in and of themselves to have the credentials to talk to us about emergency preparedness. But he also has a BA from Stanford in human biology with honors in decision-making in global biodefense. He has 15 years of professional experience in public health, disaster relief, humanitarian crisis management, and PTSD services. He's led multinational responses in Haiti and the Philippines. He's been a response leader for Hurricanes Katrina, Sandy, Harvey, and others. He's been a mass care director for California state disasters, including the Camp Fire, the Kincaid Fire, and the Santa Barbara mudslides. And he's currently the Chief Disaster Officer for Beckman Ready, where their mission is to make preparedness and readiness easy. Welcome to our Q&A, Luke. Thank you for being here.
Of course. Excited to get through the questions.
Excellent. So let's go ahead and start with sort of the very basics, even though we're not here to offer medical advice, but the very basics of what are the symptoms if you think that you may have been exposed or infected with COVID-19.
Great. And we wanted to start with this because A, lots of people are asking questions, and B, I think everything flows from these symptoms. And so we wanted to hit it right up from front. So if you watch nothing else, at least you know if you might have COVID-19. COVID-19 is a type of coronavirus. There are many coronaviruses floating around right now, and COVID-19 is the one that we're all responding to. So fever, cough, shortness of breath. Those are the three things to look for. Patients who are coming into the hospital are pretty much universally presenting with cough and fever. The shortness of breath piece, you may not start there. And if you can sort of think, well, okay, what does shortness of breath mean? That's really, if you get up and go to the bathroom and you're having a really hard time breathing, more difficult than normal, that's shortness of breath. And that's when you want to go to the hospital, meaning your lungs are compromised or they're going to get there soon. If you just have a fever or a cough, you may not need to go to the hospital. You might be able to take care of yourself at home. But we wanted to focus on that, and that shortness of breath, that's sort of that's your emergency sign.
Thank you. That's very helpful. All right, I'm going to move on to the very kind of first question that we've had from the women that came up that said, what are your thoughts, Luke, on the severity of the crisis? How can it be solved, and how long will it take? And just FYI, I'm going to take this question down so we can focus on your answer.
Okay. So the severity of the crisis, this is definitely something to pay attention to. I would encourage everybody to not panic, but this is absolutely very serious. It can be hard to tell in a 24-hour news cycle, and you're getting tweets and texts and posts and chats and blips and bloops on your phone, and you're just constantly getting inundated with COVID-19 things. I want to sort of take it from the emergency response perspective. We as a society, as humans across the globe, got behind with this virus. There were a lot of leaders who are minimizing the severity of the outbreak for several months, and that's not just in the US. And a lot of intelligence and public health and response experts knew how serious this could be. But what we're seeing now is social distancing is increasing. And whether you call it social distancing, the World Health Organization is talking about physical distancing, but that 6 feet person to person distance, um, we're going to see that in place for at least another 2 months. And some folks are talking about a year. A lot of this is up in the air and ever changing as we look at the public health models and we look at how the public responds. So the first thing we're trying to do is to flatten the curve, and that really reduces the cases. And what we're trying to do with flattening the curve, not just reducing the cases, but we want to focus on building up that medical infrastructure, hospitals and support services. And that's people, beds, as well as equipment. But we also know that over time, people are going to get tired of the social distancing. It's a strain on the economy, and people will likely get relaxed. And that's not just individual people, but that's also the decision-making level. And so there could be a small spike, and then maybe it comes back under control. When I say maybe or could be, that is conjecture. That is me thinking and looking at the crystal ball. But we do know that this is serious. This is going to go on for a long time. And a lot of what happens is going to be based on how we as mankind respond to COVID-19. And the big thing to emphasize here is that your behavior affects my health, and my health or my behavior affects your health. So this isn't just you watch me going about my life, but everything that each one of us does is affecting everybody else. And I think that's a really important message to get across. One site that I would mention now, and we'll make sure that any link I talk about or reference, we'll find a way to get a document attached to this and link you to them. But the website covid19.healthdata.org/projections is a fantastic resource. In the United States, the White House Coronavirus Task Force is going off of that data set. And when you want to look at projections, you'll see the peak or the spike in cases, in fatality, to get a sense of where the numbers are going. And so rather than me trying to tell you what I think the number will be in 2 months, I want to reference you back to some of the best data that we have available. And I think a couple other points to hit on is that most disasters, most emergencies that we see affect a very specific place for a short period of time. So if you look at a hurricane, we see a hurricane coming maybe for 7 days and it's aiming for Florida, and then it hits, and then 3 or 4 days later, your house might be destroyed, but the hurricane is gone and then we recover. What's different and difficult about this virus and this pandemic is that it's going on and on and on, and it's affecting everybody. But our houses aren't being destroyed. So everything looks fine, but we can't be out in public, and it's changing our behavior. So one of the reasons why not just the economy, this is so serious is, yes, we're focusing on the mortality and the morbidity. So who's dying and who's getting sick, but our brains really aren't wired to process this kind of risk. And so that helps explain why the world was so slow in many ways to respond, right? It's not going to happen. It can't happen to us. And when we sort of project out, we start thinking, how should we be feeling? And I think that's at the root of the question, which is people are feeling angry, they're feeling scared, maybe they're feeling empowered, depending on where you are and what your place in society is. But we want to try and shift from that angry and that scared over to the empowered. We don't want you to feel helpless. And I hope through some of the questions that we answered today, when you walk away from this talk and this Q&A, that you'll feel more empowered rather than scared or helpless. So the good news, and I want to start on this positive note, the good news is that you really can protect yourself and your family by following some very simple rules. And the biggest takeaway that I can give you is don't touch your face. And I'm probably going to do that about 5 times on this, maybe 10 or 15 times as we talk today. You get an itch or your eyelashes in your eye, but avoiding touching your face, practicing that, really practicing, because it's hard to do, is critical, and washing your hands. So that is the best defense that you can take against COVID-19. The primary way that you're going to contract this virus and get sick is by touching a surface that has the virus on it, and then touching your eyes, your nose, or your mouth. That's how you're going to get sick. There are other ways, and we're going to go on and on about how you should watch vegetables and can you get it off touching this grocery bag or whatever it is. But all those common surfaces, those are the things, elevator buttons, railings, countertops, you're probably going to get sick, not necessarily by somebody coughing in your face, but by touching a surface with the virus, touching your face. So we're going to talk about some ways to avoid that. But I want you to take away the message of this is serious and we should focus on it. This is not a time to panic, and that there's a lot that you can do to protect yourself and your family.
Thank you. I think that's really the goal of this Q&A as well, is just to have as much information to understand that we are in control of our own lives and what we can do, and there are steps we can take. So I'm going to go ahead and move on to the next question here that we had from the panel of women that came up with these, or the group of women. What is the long-term picture? I think you touched on it a little bit, but I think if you can talk about, you said, here I go touching my face, anywhere
That's right.
between,
We'll do a little counter every
we'll
time we
do it,
touch our
do
faces. We
not,
got to put
yeah,
a dollar in the jar.
do not
Yeah.
behave like Anya ultimately. But essentially you talked about, it could be 2 months, it could be a year. Could you talk a little bit about, what might be like the most severe and what might be other things that are happening in the long-term picture?
The long-term picture really does, and I'll keep coming back to this, it depends on how we're going to react and how we respond. There are a number of states right now in the United States that don't have enforced social, or not enforced social distancing, but enforced shelter-at-home orders in place. And so what we're hearing in the news is people are saying, oh, I'll be fine. And, it hasn't happened yet. If you wait until you start seeing more cases, it is too late, because at that point we have community spread. So the long-term picture really does depend on our actions now. And this whole social distancing thing is we're trying to buy time for testing. Rapid testing is key, where we get results in minutes, not in 2 days. And I know we're moving there very, very quickly. But we also need time to buy time to ramp up medical capacity. I mentioned earlier, beds, ventilators, and medical personnel. But the testing really provides two functions. It's diagnosing those who are sick, and then surveillance. So we can see where the virus is hiding, and especially in cases where the symptoms are mild or they don't show at all. So that diagnosis and surveillance is best by doing something called contact tracing. So if you get sick, Anya, we have to figure out who you touched and talked to and were around over the last couple of days, and that's going to help us sort of put a lid on this virus and this pandemic. So rather than going with the sledgehammer of everybody has to stay home, we want to get to that scalpel, right? We want to figure out exactly where the hot spots are. The long-term solution, and this really gets the long-term picture. The long-term solution is a vaccine. But we might be 18 months from that vaccine based on what I've been hearing and what some of the best experts are saying. So if you count 18 months, maybe that's September 2021 from when we're recording today. But here's what we know. We've never seen the economy really shut down this long before. Sure, a recession or a depression could be possible. Some of the facts that we know, I'll look at my notes here, but the Great Depression peak, I think unemployment was just about 25%. And a recent report by the Federal Reserve, they were projecting job losses could be 30% unemployment. And if you go back historically, in March 2009, the worst month for job losses, March 2009, during that recession we had, was about 800,000 lost jobs. And we could see in April alone of this year, we could see job losses 500,000 to 5 million.
I think I just saw a number of above 3. I think we're at 6 million for last month of unemployment.
Yeah. So this is really serious when we look at what the economic impacts are. When you look at the mortality, the death projections, you see numbers in those models, and that URL I mentioned before, 200,000, 2 million. It depends on our behavior. So we have to look at the long-term, sort of advanced planning. We have to look at a long-term picture across multiple sectors and multiple geographies. In the US, we know that confirmed cases and deaths will go up. Part of that is due to our increased ability to test and report. So just because you see the number of cases spike, it doesn't necessarily mean, oh my God, this many more people got sick today. It may mean now we can actually test this many people. But we also know that our medical capacity is going up. We're seeing more production of ventilators. We're seeing recruitment of healthcare professionals. We're seeing more alternative care sites being set up in convention centers and gyms where you can put a whole bunch of people who are sick and take care of them in a big group. We'll be getting more personal protective equipment. The economy, a lot of industry is shifting to do that kind of production. But our goal is to increase capacity to meet that apex, right? Where's the highest point of infections? And the virus will peak in different places at different times. We know that as well. But if we relax social distancing measures, we will also start to see the virus spread again. We'll probably also see a shift in supplies to different hotspots around the world. And that's not just in the US, that's also globally. So we've seen that sort of that move from China to Italy to Iran, South Korea, Hong Kong. And we're seeing international flights coming into the US providing us with critical supplies. And at some point, the US may be able to ship some more supplies overseas to help other countries out. But the odd thing with this pandemic, and this is true of healthcare stuff, is that the better we do preparing and responding, the less sickness and death that we see. And that's a great sign. So you might say, well, we have all these extra beds. That's great. We're trying to ramp up for that. The question becomes what happens with the economy? Companies are taking out loans from banks at an incredible rate, and we're really trying to keep people from losing jobs so the economy doesn't tank. But it's, and I'm sort of talking about what we know, and from a planning perspective, what's likely to happen. I'm not going to give you my own thoughts or numbers because I don't think that's helpful, right? I'm not an economist, but I know where to go, and I know the reports to read for those economists, right? So I'm gonna look at the Fed. I'm not gonna find some Facebook thread with no attribution and no source, and then share that with all my friends, because that's the kind of thing that can start to cause a panic or everybody freaking out. But there are a lot of influencing factors, and these public health models are really trying to take all of that into account. But the biggest thing that we can influence, I talk about this in a response world. Think of two circles. There's what you can control, and then there's what you can influence. And then there's everything else. So if we focus on what we can control, you and me with our families and our friends, we can control social distancing. And it may feel like I can't control anything else happening in the world right now, but I can control that social distancing piece. And that is part of the response. So very strangely, we're all sort of victims to this, but we're all responders. And we've never seen anything like that before in our lifetimes. So that social distancing piece, we're trying to buy time for testing. Once we have that test available, then we can start to go from that sledgehammer, everybody has to stay home, to finding those targeted hotspots. And then hopefully from there, we can get the economy going again. So a solid strategy from the federal government with a pandemic and public health responses, a strong federal response is critical. The states and counties right now are looking to the federal government for support and to move all those materials and resources across state lines. That's a federal task. And what we've seen predominantly is a lot of the strategy, sort of states, governors are talking to governors, counties are talking to counties. And so look for that as that change in, is the influence happening at the county level or the federal level? But those resources really have to be brought in federally and moved around and prioritized. And here's the other thing. We're going to get through COVID at some point. I don't know when. But there will be another pandemic, and there will be this, we're coming at sort of flood and hurricane and wildfire season. There are going to be other natural disasters that happen. That's life, living on planet Earth. And so it's important to realize that we have to start learning lessons now, and we have to learn fast, and we can continue to prepare for the next thing, whatever that is. So maybe that gives us a little more ownership, a little more agency, where we don't feel as sort of helpless or as victims like we could, and we have a little bit more positive influence, and we can become more of that responder.
Right, and just knowing exactly what we can control. Yeah, I think that's the most important thing. Things will happen. We are gonna own what we can. So,
Yeah.
Luke, I'm gonna move on to the next question here,
Great.
so we can get through all of these. And so, the next sort of question that we had is, what lifestyle changes are going to be here for the long run, right? We talked about the social distancing, where we're really all extremely distanced, and including 80% on lockdown, not able to go out and perform some basic functions. How do we start to ease that? What is it going to take? And what are those styles that will stay with us?
Well, we know social distancing, that's going to be here for a while. Get used to not touching your face. It's hard, and that's why I say practice it, right? Like, I want to do this, and I'm conscious. I have an itch under my right eye right now, and I'm consciously trying not to itch it. So
It's
maybe
because
I'll,
you can't.
twitch a little bit. That's right. All right, that's it. We're going to see more telework, not just in the immediate, but in the future. People are going to get used to that. More distance learning, more telemedicine, so talking to your doctor without having to go into the office. the questions that, I think make sense to ask and think about are more companies going to support telework in the future? And is that going to reduce traffic? Like Monday to Friday, rush hour traffic, will that go down? Will more people take public health professionals seriously? Will we heed their warnings, and will we start to see increased control on that public health side? And then will we also see a larger shift in the workforce? Don't know what that is right now, but people who are out of jobs, humans are innovative. So what are we going to see bubble up from there? So lots of questions, not a whole lot of answers right now, but pay attention to what people are doing now, because the longer we do that, the more it's going to stick.
It's interesting you brought that up. I'll just chime in here that yes, in the last recession and the big change, we've had lots of innovation, and I'm sure
Mm-hmm.
that will happen by virtue of necessity, right? Lots of companies came
Absolutely.
about in '08 and '09, including Venmo and Uber and so on. So we should have
Mm-hmm.
some faith that we will cope with this.
Yeah.
All right, thank you for that, Luke. Let's go ahead and bring up the next question. So how can we cope given the new reality? So you just said social distancing is not going away, new lifestyle. How will we cope with this?
Oh, what a question. I think there's a try and true method is to focus on a positive mental attitude. Now, what does that mean? And who's this guy telling me to be positive in the middle of just all this chaos? The positive mental attitude, when you look at generally when emergencies happen, who survives? It's people with that positive attitude. Now, that's tough, especially the longer this thing goes on. I think we talked about that control and that influence. Focusing on what you control, what you can control, is extremely important. Focusing on the present. This is a temporary state, and I think it helps to say that. I've been doing this emergency and disaster work for 15 years, and I've seen all kinds of trauma at the human scale, sort of the broken arm, all the way to the societal trauma. And I've been trained in this, but it's still tough for me. History tells us that we're gonna survive through this thing as a species, and this is a time to be cautious and be vigilant, but not to overreact. There's a great site, grief.com. You might say, why is he talking about grief? A lot of these feelings that we're all feeling are actually signs and symptoms of grief, in the sense of I'm grieving in a weird way that I can't see my friends, or go visit my parents, or go on that vacation I wanted to, or go out and about and go to that concert, or I lost that money, or I lost my job. We're grieving for different things, and acknowledging that, talking about that, and being honest about it is wonderful. And we'll provide some resources with some great links. There's a lot of people talking about this right now, and there's a lot of wonderful support networks that are emerging as a result of this pandemic. The one that I find that's really easy to do, that you can do right now today, doesn't cost you anything, is focus on some breathing exercises. I've tried to get on the train of meditation forever, and I can't seem to do it. I'm not doing great at it, and I probably need it. But one of the big things that I really focus on is breathing, and I start with 3 breaths. So even if you're super crazy and you don't have any time, everybody has time to breathe 3 times. And what I mean by that is a conscious breath. So think in for 5, hold for 5, and out for 5. You do that 3 times, even in the middle of a crazy day, or when you feel like you're just going to light your hair on fire and run around in a circle. That's sort of a centering or rebalancing exercise. And also for perspective, imagine if we had to do this 60 years ago, where we didn't have the internet, and we didn't have cell phones, and we didn't have video conferencing. How much more isolated would we be? And I think that's just a really good sort of level set and gut check, that it could always be a lot worse. But that's not to diminish where we are now. But again, talking about it, working through it with your friends and family, not just keeping it bottled up inside, I think that's a really healthy thing.
Yeah, thank you. I just joined a meditation group with friends, of course, on
Mm-hmm.
Zoom, and it was amazing. That breathing exercise, I'm not really a meditator, but that breathing exercise was awesome. So thank you.
Mm-hmm.
All right, I'm going to move on to the next question. What steps can I take to prepare my family? So I know we have a couple listed here.
Mm-hmm.
So let's go through these before you talk about some additional ones that you have resources to share.
Sure. So again, what can we control? And I'm going to keep coming back to not touching your face, because you're going to see 1,000 articles and blog posts about what kind of mask you should make, and do you sew a button on the side of a headband, and all those different things. But at the end of the day, focus on not touching your face. Practice it, right? Call each other out when you do it. at home when you're safe and you've washed your hands. That's a big one because that's going to keep you healthy right now for COVID. But let's talk about a couple other things. Creating a budget. This is one of the biggest ones. And you might say, well, Luke, I'm at risk of losing my job, or I already lost my job, or I'm not getting any hours, so I'm not getting paid, even though I'm not, fully unemployed. It is never too late to create a budget and build emergency savings. Now, what do I mean by that? We're not going to go into all the details of it. We'll get into a little bit more detail in a couple minutes. But focusing on what's coming in the door, what's going out the door in terms of my income and my expenses. Understanding what that is a really important step. And as much as you can, start day by day by day, building out some of those emergency savings. Can't emphasize that enough. Backing up important documents and updating wills. People are going to get sick. They're going to go to the hospital. Some people will pass away, and some people will die during this pandemic. You do not want to get caught as a family. Even if somebody just gets really sick and they don't die, you don't want to get caught without the, what do we do or what happens with this? There's a ton of extra stress and frustration and grief that comes down the road if you haven't checked up on the family will and making sure everything's up to date. But backing up important documents, print them out, make a hard copy of different things, save some of the numbers in your phone. There's a lot of resources online that talk you through those tips and tricks. And I'll get back to that positive mental attitude. At the end of the day, it could be absolutely terrible, but things can always be worse. And focusing on what you're grateful for, focusing on what you do have, I think that's a very healthy thing to do. Especially if you've got kids, and I know our audience right now, everybody's got a kid. Focusing on your kids and not overexposing them to the media and going out for a walk and throwing rocks around and looking at clouds in the sky. There's a lot we can do to maintain normalcy in life in the midst of all this chaos. One thing we'll make available after this is there's a whole bunch more tips and tricks and easy steps that you can take that don't cost you anything, that can prepare you not only for COVID, but sort of any emergency, any hazard. As I said, we're coming in the middle of the country, floods and tornadoes coming up in springtime, wildfire season a lot in the West, and hurricanes this summer. And every day we've got house fires to worry about, normal earthquake season 24/7, depending on where you live. And so those kinds of things can happen. So in the midst of COVID, it's important to not just forget about everything else we were trying to do and to really plan, because I think that gives us more control.
That's a really great point. I think, we are literally, every one of us in this
Mm-hmm.
country and in this world, focused on this, and we've been forced to do that. Your
Right.
job's been more difficult because you're only working in the communities that have been affected. Very seldom, if ever in our lifetime, everyone's been affected almost
Mm-hmm.
at once, right? So this gives
Right.
all of us an opportunity. This is great advice for everyone. So it's always great advice, but it's so much more poignant to take that now because we're living
Mm-hmm.
it. So I'm going to move to the next question here. How can I prepare my family financially? If you can talk some of the points that you've
This is a
listed.
tough one, and I know it feels like we're beating the hammer on this one, but I think this is really important because if everybody had a job or everybody had income coming in the door, then we'd say social distancing. Sure, I'm going to hang at home and we'll be fine. But right now, it's people are losing jobs. It's very real, and there's a lot of uncertainty. So let's start with what we can control. Again, listing out your assets, your debts, and your loans. So again, what has to go out the door in terms of my expenses, whether it's a debt, a loan, or my rent, my mortgage, something like that. The assets, what do you have? What do you own? What's value for you? Capturing those recurring payments. There's going to be a lot of hidden payments that we probably have all signed up for. Now might be a time to evaluate, do I really need to pay for that, whatever, you name it. And looking at your bank statements, because I can guarantee you there are probably some things that you're paying for on a recurring basis that you don't know about right now. And you're saying, wait, I thought we canceled that 8 months ago. So checking that's really important. Building that budget, trying to see what are my basic minimum critical expenses. And then what's luxury, what's fluff on top of that. Maybe you can take some of that fluff out of your budget and put that towards either paying off some different things or starting to build that emergency savings. Now, we talk about in the emergency world, I tell everybody who I can, 6 months is what you want to plan for. But if you don't have any emergency savings right now, and I know where most of the country is, I think it's about 78% of Americans are living paycheck to paycheck right now. That is a hard thing to do, to go from paycheck to paycheck to 6 months of emergency savings. That takes a lot of discipline. That takes a lot of time. But where do you start? Let's get a week of emergency savings. Let's go 2 weeks. Let's go a month. Let's just try and get something, right? Go from $0 to $1 and then build from there. Really scrubbing that budget is important. A couple of the things that I think are also important here, contacting, if you own a home, contacting your mortgage lender, writing a hardship letter, trying to get ahead of that curve, because a lot of people are going to start doing that. Maybe consider taking out a personal or a home equity loan. 0% interest credit cards. You generally don't want to try and get interest on a card anyways, but that could be a way to hold the line a little bit. So don't rack up the debt if you don't have to. That's why I talk about reducing a lot of your expenses as much as possible. And then money that you put towards retirement could be better invested right now into an emergency fund if your job doesn't seem so secure. So if you are still employed and your company does a matching contribution to your retirement account, maybe hit that level. And then with the rest, you could direct that into an emergency fund. If you're young, maybe maxing out your retirement account makes a lot of sense because you can ride the market up and down for a long time. But that's the icing on top of the cake, right? That's if you have money to even be able to put into retirement. So I want to acknowledge that. But the last thing here, we talked about prioritizing your spending and saving, but reviewing your insurance policies. Again, an emergency can happen anytime. The last thing you want to have happen to you right now is, let's say you have a house fire and you don't have renters or the right kind of homeowners insurance. Do you have earthquake insurance, flood insurance? Reviewing your insurance policies, even health insurance, to see what's covered. A lot of people think that, because I got this great shiny package and I talked to, Bill or Susie, my insurance person, and they say I have a great plan. Take a look at the details. Call your insurance company. I know there might be long wait times on the phone, but check and ask them in very blunt language, what's covered? If this happens, what is covered? If this happens, what do I get? Insurance is a fantastic thing to have. And although you might say, well, Luke, you told me to look at the recurring expenses and I pay $20 a month for my renter's insurance. So can I take that $20 and put it to the emergency fund? You certainly could, but again, that insurance is a sort of your first line of defense. And so maybe that's the last recurring payment you cut. So important things there, because you do not want to face a physical natural disaster and be caught without your insurance.
That's great advice. And if you don't have something to review, that's also a key area to think about. That means if you don't have insurance, you should be looking at that. Either you have renters or house insurance. So I think that's the key. Great. Thank you so much. Let's move on to the next question. Let's get practical, specifically around COVID. If someone gets sick at home, how can someone take care of them? How should we take care of them?
Great question, and something that is probably going to happen to many of us, if not all of us, right? I think if you look at the numbers, we all have seen somebody who has COVID, whether it's on the news or elsewhere. Very soon, we're probably going to be knowing people who have COVID. And if we can educate others, then that keeps more and more people healthy. Again, now we're taking control of the situation and we're responders and we have control of that. So people are most likely to get sick through sustained contact with someone who is sick. So just walking by the street, could you get sick? If they're sick, it's possible. There's a lot of data out there that is not, or I should say, there's not a lot of great data that tells us exactly, how many viral particles are spit out of my mouth when I'm talking, and can somebody walking by me on the street get sick? It's possible. Not the most likely way of you getting sick. We're talking sustained contact. So I live at home with them. So I want to emphasize that. The other way you're going to get sick, again, and now I'm going to sound like that broken record, it's touching a surface with COVID and then touching my face, eyes, my nose, or my mouth. That's easy to prevent. So policing your hands, knowing where your hands are at all times, even if somebody is sick at home, the best way I can care for them is by not getting sick myself. So washing your hands and using hand sanitizer for that. Just constantly focus on, don't touch my face, don't touch my face. The other thing I would mention is putting something over your face. We just saw as recently as today. What's today? Today is April 2nd, 2020. I should say this because maybe somebody watches this in a couple weeks. We saw guidance from the Centers for Disease Control in the White House today talking about wearing an actual mask or a face covering. A lot of that is to keep you, to focus on you, sort of make you conscious of not touching your face. But we also know that any kind of barrier, when I'm speaking, talking, sneezing, spitting, coughing, whatever, is going to prevent viral particles from going through. So even if it's a shirt or a piece of cloth or a bandana, that might help keep others from getting sick. So if someone at home gets sick, having a mask over them, or having a covering over them, again, you don't want to restrict that airway at all, but putting that bandana, putting a mask, so that they are less likely to get other people at home sick. If you develop a fever and you are otherwise fine, which is what's going to happen to most people who get COVID, very few people are actually going to go to the hospital, and very few people are going to get put on a ventilator, and very few people are going to pass away compared to everyone who gets this virus. So if you develop a fever and you're otherwise fine, the best guidance really is to stay home and isolate yourself from your family. Now, if you're in a studio, kind of tricky. But if you've got an extra bedroom or an extra room or an extra bathroom, that's where, if possible, you want that sick person to stay in a separate room, or to use a separate bathroom, because we're trying to avoid that sustained contact with the person who is sick. We talked about in the symptoms, fever, body aches, you're going to feel like crap for probably 5 to 7 days. Taking Tylenol for your fever, not ibuprofen. There's some early data on this one, but if you feel like you need to take some medication, what we're hearing from the medical community based on just sort of early results and reports is to focus on that Tylenol over the ibuprofen in terms of better outcomes. If you start feeling better after about 7 days and you're not taking medications, then you can start to interact with your family a little bit. Now, what if you have a mild cold? Is that COVID? No, it's probably a cold. But if take those precautions for 1 to 2 days to sort of really see what you have, and if you start feeling better, then it's probably not COVID. If you're living with someone who's vulnerable, so we're talking the elderly, we're talking anybody who's gone through chemotherapy, somebody who's just had surgery, diabetics, people with heart or respiratory issues, that's somebody who's really vulnerable. That's where you want to try and call your primary care physician, because we want to try and find alternate living arrangements for that person. They can decompensate, they can get really sick quickly, and they also don't have as strong of an immune system to fight off COVID like we might, younger folks. But it's also important to note that if you're over the age of 14, based on the data and sort of the patient data and who's getting sick, you can get this. So just because you're 16 years old, or you've got a teenager at home, doesn't mean they're invincible. They can absolutely get very sick from this. So we've got to take that seriously. And I think a lot of the work, as family members to younger family members, is to let them know that they have a role to play in this as well. But if sick in a fever, stay hydrated, get your rest, relax. If you're handling food, so getting that to the sick person, just make sure you're washing your hands and not touching your face. And you don't want to be leaning over them, checking on them every single day. But you do want to be caring. You do want to support them. So if
taking the
possible, yep.
taking those precautions, I think that's really helpful, is just to remember that this person is infected, clean up, make sure you take all those specific measures so that you're staying healthy and that you can take care of them, or potentially take them to the hospital if necessary.
That's right. And again, on the data, a lot of people are saying, well, if I get COVID, I got to go to I'm going to the hospital. If again, we talked about that shortness of breath, right? And what's shortness of breath? That's I'm getting up to go to the bathroom and I'm really struggling. That's people who are going to experience that shortness of breath. That's about 10% of people based on the patient data right now. About 10% of people are going to the hospital, or we need to go to the hospital. Of that, 1 to 3% of that 10% are the people who need to go to the intensive care unit to get on a ventilator. And most people are coming off of a ventilator about 7 to 10 days later. So getting COVID is not a death sentence, but it is something to take very seriously. And I think the next question that might flow is, should I get tested if I get the disease? In a perfect world, if we had all of the tests and everybody could get tested, sure. But right now we're kind of short on tests as of today. So I think it really depends on availability in your community. So go online and search your local public health department, and you'll be able to find pretty quickly what their recommendations are. Because You don't want to take, at this point today, given that we have a shortage of tests, you don't want to take a test from somebody who could become very sick off of COVID. And you want to take care of yourself. I get that. But we're all in this together. We're all a team. The next question that could flow from that is, what about infants and newborns? We're not seeing a lot of sort of the mother to child transmission, not happening. And again, we still need to get more data on all of these different things, but young kids, generally under the age of 14, are not dying and not getting really sick. But looking at teenagers and up, you can definitely get sick. And we have seen some very serious cases for young people as well as old people. We just know that it's going to happen more and more to old people. And we'll also provide a couple of resources with some physicians who are working on the front line who've been recording testimonials of what they've been seeing, and we'll make that available to you as well. Because I'm just an EMT, but I spend a lot of time around a lot of doctors. I know how to read research studies, and I've seen a lot of what's going on. But I want you to be able to hear it from MDs as well.
That's great.
And
Thank you.
everybody has a different perspective. The stories coming out of New York City right now are very different than the stories you might see in California or Texas or Florida. But there's sort of, think of it as the canary in the coal mine, right? It could become that bad where you are, but it may not be there now.
And it's also changing so quickly, right? That
It
it's
really
really
is.
important. That website that you shared, we'll put that up as well with this information.
Mm-hmm.
You really want to stay on top from resources that are validated, that are, the CDC, the
Mm-hmm.
WHO, government resources that tell you the real information that's really happening.
Mm-hmm.
So I'll move on to the last question for now, is if I get COVID-19 and recover, can I
Mm-hmm.
go about my life normally? Is this basically like a free pass and I'm
Oh.
done?
Yeah, I wish it was sort of the get out of jail free, or pass go and collect $200. It's not. In short, if you get COVID, can you go about life normally? No. Here's why. And I want to give you the detailed answer. So as of today, April 2nd, 2020, we don't believe that you can become reinfected with COVID. There is more work to do. There are some anecdotal reports of people who, they got sick again. What we believe is that they didn't get reinfected. They ended up just sort of getting sick again from the same infection. But in general, people are not getting reinfected. Now, we're still early into this pandemic, into this sort of this viral understanding. So we'll learn more over time. But here's the big thing. Number one, we need social distancing in place for everybody. So you are a role model. People look up to you. So if you're going about your normal life, then people are saying, well, I can go about my normal life. Here's the other thing. Any one of us can touch a surface with COVID on it, and any one of us can touch somebody else or touch our faces or touch. So the virus can still move around from person to person. And if you want to test how that works, if you want to game with the kids, it's going to be impossible to clean up. Put a little bit of glitter on your hand and shake hands with them or touch a bunch of things and look how fast the glitter gets on everything in your house. The virus is kind of like that. So while you may not be able to get sick again, we need to keep a lot of these social distancing, physical distancing, right? These societal behaviors in place. But what we might see is the government and society calling on you, if you've recovered, to get back to work, to get out there in a social distance environment, because we know you're not going to sort of be a strain on the medical system now that you're healthy again. But we still need to keep those practices in place.
That was really helpful, and we all need to do our part. We don't know enough about the outcomes from what's happening, so we need to be
Mm-hmm.
cautious. So thank you for that. So let me close this out just by sharing that if folks have additional questions, you're open to getting emails from folks. I'm happy to also
Absolutely.
connect anybody with Luke if necessary. So feel free to email any one of us. By no means, should you feel like that's not an option. So we hope to actually maybe look to do it again in terms of like things will be progressing in a couple of
Sure.
weeks. We might have additional information about how things are changing. But thank you so much. This was super helpful. I think it allows us to get information from someone like yourself. You've been dealing with a lot of emergencies. This gives us not just a picture around what you need to do today around COVID, how to prepare for other emergencies and disasters, and that you should really think about that. Hopefully this gives us a more of an opportunity and more of a like kick in our butts to go do that. So
Yeah.
Thank
Absolutely.
you
And
very
you
much.
know, I, I'd go ahead and close with the, uh, we heard a lot of stressful or negative information maybe, right? Because COVID is not a pretty thing. You know, it's not like we're all waking up to sunshine and rainbows. That positive mental attitude is really, really important. Saying hi to people, treating people like humans, smiling, I mean, that's what makes us human, right? And so still engaging with people. If you see them across the street, wave and say hi, right? You can do a social distance wave. That's what a wave is, right? We're not chest bumping and shaking hands and slapping high fives anymore, at least not for right now, for a while. Um, but check in on everybody. With technology, it's really easy to pick up the phone right now, and I think we're all doing that. Get outside, get your walks in if you can. Having a good physical health is really important, right? Just like every virus, if I'm hydrated, if I'm well rested, and I'm not stressed, it might be harder for me to get sick. Um, and I'm just going to be a more pleasant person to be around. And to the whole treating other people the way you want to be treated, and just with kindness and respect. Um, we're all just trying to find information about this thing. And the one thing I would urge you, because we're constantly fighting it, is sort of that misinformation. There's so much going on right now. It feels like everybody's a public health expert, everybody's a doctor, everybody's an epidemiologist, everybody's a responder. Um, focus on those key and core sources, and we're going to try with what we attach to this video. We're going to make some of those available to you. And if you share something, make sure you know what the source is for that, and attribute it, because it makes it really hard to walk people back. And we always say, sometimes you got to tell somebody something 6 times for them to really get it. And if we're throwing in a whole lot of misinformation, it's going to make it harder for us as a society to rise above this thing. So that's what I'd like to close with. But I really appreciate you having me on. And these are fantastic questions. And thanks to everybody who came up with these and took the time to put them together.
Well, thank you again. You've made me think about two things. Let's be kind to one another and don't touch your
Mhm.
face. And I've been
That's
very
it.
cautious of not doing that through this video. I've improved over time. How about that? Thank you so
That's
much,
all we can
Luke.
do, right?
That's
You bet.
right.
Have a great day.